Dr. Diana Pillay, welcome to the Social Network. Good afternoon.
Thank you, Selma. Thank you to all the listeners for tuning in. It's a pleasure to be here.
It's wonderful to have you.
Thank you for that. The kind of introduction.
Had to lay it out there just so we know we have the expert here on the other side. It's not me answering the questions, of course.
Well, I'll try my best.
We're also live streaming on Facebook as well. So if you wish to view in studio, and we're also just going to talk in general terms. We cover medical cancer on a lot of the shows. We have medical files and we have the other programs that have been tapping into cancer in children, cancer, breast cancer awareness. And we always tend to talk about those kinds of issues. But a lot of the time, there's just simple questions that the average person has. There's simple conversations that are happening over the dinner table, among families, in our homes, whenever cancer becomes a topic. So we wanted to just tackle the general frequently asked questions. And if you have any commonly frequently asked questions, maybe common misconceptions, you're welcome to pop us a WhatsApp as well, 060-904-1056. So let's start it off first and foremost. Cancer itself is a broad term, but how would you categorize it when a person says, okay, they have cancer or could have cancer? Or what is cancer, first and foremost?
Okay, so cancer is a disease. It's a disease like any other disease, and it's just been synonymous with something more ominous over the years. Fortunately, being an oncologist for 2 decades, as Salma said, I've seen the evolution in terms of cancer statistics as well as therapeutic options, so that is treatment options that are available to patients. So there is more talk about cancer. It's like programs like this which raise awareness. So we're seeing an increasing number of people diagnosed with cancer, so with the disease cancer. And if you look at statistics for the Cancer Association statistics, the most recent update was in 2020, and there were at least 110,000 people diagnosed with cancer in South Africa.
Sure.
So that's a significant number of people. And that's why you have so many people talking about it. You're talking about it at the dinner table, you're talking about it at other meetings, maybe in more formal settings, informal settings, but it is very, very prevalent. And I think when you look at those statistics, what we've realized is that cancer has now outpaced infectious diseases in South Africa. It used to be tuberculosis, HIV, but cancer is more prevalent. And that's why it's important to know about the disease. It's important to know how can we prevent it? How can we diagnose it early? How can we treat it? So hopefully we'll be able to answer some of those questions in today's show. So that is really it. Yes, yeah. And of course, the discipline of treating cancer is called oncology. And I just thought I'll mention it. That's what we are called, oncologists. Yes, by the way, yes.
Now, another misconception I personally noticed that every time, maybe it's the color pink that's been associated with the cancer in October,
yes.
When it comes to cancer awareness, that is almost given very much as a female problem. And
yes.
I feel when you see the events for cancer, yes. It's women in attendance, majority women.
Yes.
Do you feel sometimes that that's putting our males in our lives at a disadvantage almost because they are not as informed as the females are? We are a little bit more conscious now of breast cancer. When we have our children, we're looking at the way their eyes are focusing on us, because you're almost as a mother now, you've been indoctrinated, you've been exposed to it, about certain things, skin cancer. If you're going to sit in the sun too long, you're going to get cancer as a woman. But what about the men that have been affected almost more and more? You're seeing men struggling with different cancers as well. How common is cancer in men?
So if you look at cancer statistics worldwide, men account for more cancer cases than women. But in South Africa, that is slightly different in that there are more women diagnosed than men. Okay. Now, I don't think it's only just about awareness, because we have other months that are dedicated to cancer that is affecting men.
Okay.
So November is Movember, and there's a focus on men's cancers and prostate cancer. But I think generally men shy away from wanting to know more. It's almost like a threat against their masculinity to talk about cancer. They also fear stigmatization. They fear the side effects of treatment, the overt side effects. So generally, I find that women are more open to knowing about cancer, to learning about cancer. For example, if I have a patient who comes in and I realize that they potentially could be something running in that family, I try and teach. I certainly try and teach the family members, but men tend to be more inhibited. They don't ask many questions. They don't volunteer to do much. So I see it as well, but it doesn't mean we can't stop trying. And programs like these can also reach out to men, because a cancer like prostate cancer, for example, if picked up early, has a amazing cure rate. It's one of the most curable cancers if picked up early. So we want to spread the word out there. And men have it easier than women in terms of their screening tests. They don't need to do too much. Women need far more investigation. So I see no excuse why men can't try to have their tests done. But once again, it requires a shift in mindset, but we're slowly getting there.
Definitely. We have a question from a listener. What does a gene cancer test entail, and how often must one have a test?
Okay. So cancer is basically something that goes wrong in our genes. So it's a genetic disease. We know that now. We've begun to understand what we call the genetic makeup of people. And by understanding that, we now know what genes go wrong and how that can contribute to cancer. So when it comes to genetic type of cancers, it only accounts for about 5 to 10% of all cancers. So these cancers, which we call a carrier of a germline mutation, so you carry an abnormality in your blood that predisposes you, or in your cells that predisposes you to cancer, only really accounts for a small percentage of patients. But we now know, based on all those studies done, and by following patients and looking at families, that there are certain families that are at high risk of getting cancer. For example, with breast cancer, if you have multiple women in a family with breast cancer, if you have multiple breast and gynecological cancers, if you have women with a certain type of breast cancer, if you have women with patients with multiple cancers in different parts of the body, then it indicates that there possibly is a gene that has gone faulty. And it's those patients that would need testing. So if you have a person who's diagnosed with cancer, you can do genetic testing on the tissue that was removed when the cancer was removed. So you can send that tissue for testing. And we're looking at a somatic gene mutation, meaning a mutation in the tissues. But if you're looking for something a patient carries in their blood or their cells, then you need a blood test to be done. It's a simple blood test. So we stratify what's the risk in a family or a patient, and then channel that kind of information into making a decision about testing. So simply, it is a blood test. And the most common one is the BRCA, or the BRCA test. A lot of people know about it. It was made famous by Angelina Jolie. It was called the Angelina or the Jolie effect. That's what an impact it made worldwide on cancer, because she is a carrier of the BRCA gene. So now we're routinely doing that BRCA gene testing in South Africa. I advocated for many of my patients as well. So in summary, it's a blood test in high-risk patients and high-risk families.
Fantastic. Very insightful indeed. If you have any other questions, 060-904-1056. This is something else that I wanted to ask as well. It's a common thing that has come up, is the moment you hear a person then it leads a healthy lifestyle, often the lifestyle comes under scrutiny, that your lifestyle is going to either put you in a direction where you can avoid cancer completely, or it could help you in fighting or combating cancer. How important is your lifestyle choices in either getting diagnosed with cancer or handling it better?
So as I mentioned earlier, only about 5 to 10% of patients are truly hereditary. So that means 90% of cancers are due to other causes.
Right.
And lifestyle plays a major part. If you look at world figures, and I came across this very interesting article. It was published in Europe. So that article said, if nobody in the world ever smoked, if we never had smokers, we would not have at least 15% of all cancers.
Wow.
So that really shows you the impact of smoking and tobacco on cancer. It's a difficult habit to break. It's a difficult habit to stop, but we can only try. As an oncologist, we try and enforce anti-tobacco rules, and we try and get patients to stop smoking. So that's one major factor. The other factors are obesity. So what we do know is if you do not exercise and if you eat unhealthily, you become obese, and that predisposes you to multiple cancers. It's quite frightening when you think about how many cancers are related to obesity. Then there's also like reckless living and exposure to viruses that predispose to cancer. So lifestyle plays an important role. And if we quantify, maybe more than 50% of all cancers are related to lifestyle changes. So if we can bring about good lifestyle changes, if we do lead a healthy life and we do eat healthily, you can reduce the chance of cancer in many people. But remember, cancer is a genetic disease, and things go wrong at the level of the cell. So patients often say, but I've always led a healthy life, and I've never done this, and I've never done that. How come I've got this cancer? So your body, unfortunately, there are what we call idiopathic causes of cancer that without any reason. But I still feel strongly that lifestyle can contribute, and lifestyle changes can also reduce the chance of cancer happening. And as you said, Salma, during treatment, I am an advocate for healthy living and healthy lifestyle during treatment. In the past, people were told to sit back and sleep most of the day or not do too much. That's not true. So a study done at Yale University in the US found that you can continue exercising, you can continue doing what you did prior to the diagnosis, providing, of course, it's not exhaustive. But that helps with quicker recovery from treatment side effects. It helps with the mental side of this journey. And it also helps with factors like gaining weight. It reduces weight gain. It provides better diabetic control, high blood pressure control, all these medical diseases that happen concurrently with cancer. So I think lifestyle is a very important factor in a cancer patient. Yeah.
Another message from a listener, Brother Yusuf Bassa says, what is the position of the platelets increase at a higher rate than the median? If I ask that correctly. Platelets.
Oh,
Platelets.
okay. So can you repeat that question again?
What is the position if the platelets increase at a higher rate than the median?
Okay, so platelets are little blood cells that we all have that form a blood clot. So when you get cut or any sort of injury, platelets then mobilize from your bloodstream to the area of injury and form a blood clot. So platelets are very important to prevent bleeding. So platelet dysfunction or platelet problems happen if it can be related to cancers like blood-borne cancers, leukemias. You can also get other blood issues that can give you a drop in the platelets. So we often see a drop in the platelet count if patients are on some form of chemotherapy. And then the rise in the platelet count is actually a recovery of the platelets. And this is what we want to, and we have a certain value to deal with. Some people have a very high level of platelets. I think that's what Brother Yusuf is talking about, very, very increased. So that's called thrombocytosis. And that may or may not be related to cancer treatment. If there is such a condition, then it's generally treated by hematologists. I'm not a hematologist, but outside of cancer, I think that question can best be answered by a hematologist. And I know that there are treatments that are available for this disease, for thrombocyte, which is the increased platelets. So I hope, Brother Yusuf, that helps in answering your question.
Thank you so much for that. So with just about 3 or 4 minutes left to news, let's just run through very quickly some of the common things that have been coming up as well. If there are any other questions, you're welcome to send them through and I could forward them to Doc, or you could just go find her at the Busamed, the Oncology Center there. First and foremost, so almost like a rapid fire round, right? Okay. So stomach cancer is the worst, the most rapid, or what's the most difficult one to manage out of all the cancers, would you say?
I think you're wrong there with stomach cancer. So some of the most fatal cancers are pancreatic cancer, all right, because of late diagnoses. There are certain types of brain cancers that are very lethal. But I think you have to look at each cancer in its unique way. A woman can have a breast cancer that is extremely aggressive. You can have a pancreatic cancer that is early and you can treat it. So it really depends on the type of cancer, the stage, the characteristics of the cancer. So I think one can't just name throw certain cancers. One has to look at each cancer in its as an entity. But bringing up these myths, because I know you're going to end. So I'm passionate about addressing these myths. So the first myth is this whole thing about sugar and cancer, and it is not true. Sugar does not feed cancer. It is really a myth out there. It's been proven that it has no relevance. Sugar has a role to play if it's you diabetic and you're having a lot of sugar and you have uncontrolled diabetes, and that can lead to poor outcomes and poor coping mechanisms with cancer. Sugar causes obesity and that can lead to cancer. But if you're an oncology patient, you can have sugar. Do not take it out of your diet. Just use less of it. Eat healthily. But what's wrong with having a treat now and then? You have to live your life. You're not it's part of your lifestyle, really. So just to add to that point, yes.
From the doctor herself.
From the doctor herself. And then the other thing is it's not contagious. You can hug a person with cancer. You will not get cancer from somebody else. That's important to know.
Yes.
Surgery does not spread cancer. Surgery is there to remove the cancer. So
that was going to be my next one. That the cancer treatment itself cause more problems.
Well, we're getting better. Like if you look at our radiotherapy machine at Gateway Hospital, our biggest challenge as oncologists has been side effects of treatment.
Yeah.
We're having a patient who's cured from cancer, but they end up with side effects. That's the traditional mode of treatment. But now with improved technology, improved techniques, we're minimizing side effects. So patients are living healthily. They cured of their cancer, living healthily with effective radiotherapy techniques. So that's just an example. And chemotherapy is also being streamlined to be more targeted. So once again, minimizing a lot of the side effects so that we really feel confident in treating patients now. We can give a lot of hope for patients as well.
Finally, in closing, as Eric is getting ready for his news, I want to just ask the necessity of testing. If you think you're generally okay, you feel normal, you have a normal family, you're healthy and everything, how necessary is it for the average person to get tested?
Well, if I gave you that statistic of 110,000 people in South Africa, that shows you how prevalent cancer is. But what we do know, and we use the figures unfortunately from first world countries that show that cancer screening and early diagnoses has improved prognosis. It improves cure rates and survival. So it is pivotal that we get the message out there that you can diagnose cancer early. We have the means in South Africa to do it. Sometimes resources are challenged, but certainly we have the means. We have mammography present. We have the prostate test present. We have it all there. So just remember, earlier stage of diagnosis, a better cure rate with your cancer. So it's out there. We know it. We advocate it. So I would say, that's
fantastic. Dr. Diana Pillay, thank you so much. We need you again for a longer time period. It's
went so fast.
I know. It's a big thank you to Dr. Pillay for sharing your knowledge. Knowledge is definitely key. Thank you so much.
Thank you so much.
Dr. Diana Pillay from the Busamed Gateway Oncology Unit. Thank you to Rafiq Nahuda as well for arranging this for us and having Doc be here with us today.